This video will show you how to properly administer your IV push medication via a pre-filled syringe. Please follow all instructions shown in this video. Administering medications via a pre-filled syringe at home can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge, and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. Please begin by preparing your work surface by cleaning area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry thoroughly as well. Use a separate towel to turn off the faucet. Gather your flushing supplies, syringe of medication, and antiseptic wipes as directed. Prepare all pre-filled syringes by holding them with the tip in an upright position. Gently pull back on the plunger, then push gently forward on the plunger to expel any air that is in the syringe. Repeat this same procedure with every syringe as needed. And finally, if heparin is indicated, once again gently pull back on the plunger and push gently forward to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Check the label on the medication for correct patient name, drug, and frequency. Inspect the medication syringe for any cracks, leaks, particulate matter, and for the clarity of the medication. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. Allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the contents of the pre-filled sodium chloride syringe as directed by your nurse, using a push-pause method. Note any sluggishness or resistance of flow. Disconnect the syringe from your injection cap. Sash Method. S stands for sodium chloride. Scrub the hub of your injection cap vigorously for 30 seconds with a new antiseptic wipe. Allow to dry for 60 seconds. Remove the cap assembly from the end of the syringe. Do not touch the tip of the sterile syringe. Attach the medication syringe, either an antibiotic or your prescribed medication, to your injection cap, and administer the contents of the syringe as directed according to your Chartwell Plan of Treatment. Sash Method. A stands for administering medication. When the contents of the syringe are empty, disconnect the syringe. Scrub the hub of your injection cap vigorously for 30 seconds with a new antiseptic wipe. Allow to dry for 60 seconds. Attach the second sodium chloride syringe to your injection cap and flush the catheter with the contents. Sash Method. S stands for sodium chloride. Disconnect the sodium chloride syringe. If your IV catheter requires the use of heparin, scrub the hub of your injection cap vigorously for 30 seconds with a new antiseptic wipe and allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the catheter with the contents. Disconnect the heparin syringe. Sash Method. H stands for heparin. All supplies and syringes can be double-bagged and disposed of with your household garbage. Wash your hands thoroughly. Properly administering IV push medication via pre-filled syringe using the Sash method at home is important to your safety. In the event of an emergency, always call 911.